2021 will be a tale of two different years. Trends influencing worker mental health, fitness, and meal plans are already changing, along with the challenges to the performance and resilience of your employees. Hi, I'm Bill Prasad, licensed professional counselor. I merge the experience of a psychotherapist, television mental health expert, and leader to work for you. I've worked as a director at hospitals, have been part of business startups, am a leadership coach, host a weekly segment for local television, and teach spin. I'm going to explain how you can help your direct reports function at a higher level, resulting in more job satisfaction, more productivity, fewer sick days, and reductions in the use of their health care coverage as we roll into 2021. Your direct reports have gone through the darkness of a pandemic. Now it's up to you to provide them with education to help them build coping skills, resilience, and find balance between work and their personal lives. I have operated a private practice for about 10 years, treating people challenged by mental health problems that include stress, depression, addiction, and trauma. I teach people to capitalize on their strengths, reduce or eliminate unwanted behavior, and be more productive at work. Research done by verywellmind.com says more people are resolving to improve their overall physical health, their mental health, and their relationships with friends and family. The typical resolutions of the past were lose weight, save more money, stop smoking, or start exercising. The pandemic may have forced us to pause and ponder our quality of life, our health, and how we connect to those we care about. Uncertainty is going to spill into 2021, which may call for more short-term goals that are highly reachable. The last 6 months of 2021 will look much different from the first 6 months. The number of people getting the COVID-19 vaccine grows as time passes. Businesses will ramp up. The economy will change. People will feel safer as they try to put the virus in the rearview mirror. Unfortunately, the circus may have left town, but some of the monkeys are still here. Your workers will have to adjust to more changes in the workplace and at home. Some will be returning to the workplace. Others will have to find a way to adjust to working from home, not just for now, but forever. Many workers will be trying to adjust to the loss of a loved one due to the virus. Others have gained weight, stopped exercising, and have put themselves at risk for a heart attack or diabetes. We have discovered who we are when we've had to face fear. Pandemics bring uncertainty, shifting information, and conflict. We have found our strengths and our deficits when it comes to handling anxiety that washes over us repeatedly, like ocean waves slapping our faces. As unusual as it may sound, many of us reveal how stress affects us by opening wide. Stress and isolation are tough on our mental health. Dentists say it's also taking a toll on our teeth. Restrictions have greatly influenced our routines, and it could be to blame for a lax in oral hygiene. I recently went to have my teeth cleaned. My dental hygienist told me she was seeing more patients for problems like inflamed gums from drinking more alcohol, likely to relieve stress. There has also been an uptick in gum disease, indicating that some people who are not leaving the house are not brushing or flossing regularly. Other problems include cracked or worn teeth due to grinding, a sign of stress or TMJ. There are also signs people are smoking more to reduce stress. Smoking limits blood flow to your mouth, which makes it easier for bacteria to grow. There are ways to manage anxiety. One is through exercise, as I discussed in my weekly segment on Houston's KHOU TV. We've all heard that exercise is good for the heart, but did you know specific types of exercise hit different parts of the brain? Aerobic exercise, like some of the work done at Orange Theory, hits the hippocampus, which can improve your memory. Taking a spin in a cycle class provides high-intensity interval training that can target the hypothalamus. This helps you regulate your appetite and reduce cravings that come with drug addiction. Weight training influences the prefrontal cortex and can help with thinking, reasoning, and problem solving. What about yoga? It affects the frontal lobe, helping you handle stress, emotions, and your attention span. Exercise can help reduce risks posed by lifestyle diseases that can influence the brain, such as high blood sugar and hypertension, along with helping you manage stress and depression. You might be wondering, what does a basketball have to do with relieving stress? Let's take a shot at an answer. So it's okay if you miss the bucket, but don't miss this opportunity to give your brain a break. Whether you're jumping rope or shooting a basketball, remember that your brain can't ruminate, worry about one thing, and do something else that takes eye-to-hand coordination at the same time. That's where your brain gets a break. Gardening can also help you reduce anxiety. That's because picking up a new skill can help build resiliency. And if you plant vegetables, you won't have to go to the grocery store as often. Cherry tomato, anyone? Baking is another way to get your head out of that dark neighborhood. That's because it slows you down and forces you to make precise measurements. And in the end, you get to eat the bread, unless your wife eats it first. So whether it's in the garden, on the basketball court, or in the kitchen, you now have a recipe for reducing your anxiety. Anxiety can also be managed through breathing techniques. Here's one technique that can trigger the parasympathetic nervous system, which is in charge of calming you down. That is the Zen place for most of us. It is called 3-1-6 breathing. Inhale for 3 seconds, hold for 1, then exhale for 6. You can test whether you're doing it correctly by using a match. Now, don't set your head on fire. Hold the match about a foot away from your mouth. If you can exhale without blowing out the match, you are taking full advantage of this breathing technique. So let's do it together. In for 3. Hold. Exhale. 2, 3, 4, 5, 6. Inhale for 3. Hold. Exhale slowly, 3, 4, 5, 6. These are just a few of the ways I have helped companies help their employees stay mentally healthy. Many of the people I see in my private practice are overwhelmed by worry, stress, and sadness. They might represent your workforce, and they can use your help and support. This program is designed for you so that you can help them. I'm Bill Prasad. Thanks for watching.